Hello, ladies and gentlemen. Thank you very much for joining me today on this live webinar on improving respiratory conditions such as bronchitis, asthma, and other breathing disorders such as snoring, shortness of breath. So feel free to text any type of health condition, respiratory health condition that you have, and I'll try to address it. After the webinar, I will try to do a question and answer session with you. So first, we're just going to cover different types of respiratory condition. Then we're going to cover a few herbs like L-champagne, coltsfoot, mullein, and lobelia. These are common Western herbs used for different types of respiratory conditions. First, we're just going to break down the different types so you can categorize your own respiratory condition. Of course, in Western medicine, you would just receive an antihistamine or a bronchial dilator. But in Ayurveda or natural cure, we have to categorize your type of respiratory condition to be able to treat it properly. So this is one reason why people have difficulty treating all health conditions, is because there's different types of respiratory conditions, just as in Ayurveda, there's 20 different types of diabetes. So you have to be able to classify it in the right category before you can properly treat it. And it's the same for these type of respiratory conditions. So the three main types of respiratory condition would be one, Ayurveda, we call it Vata restricted, where you have cold, dry and cold respiratory tract, particularly shortness of breath, wheezing. This is the alveoli, the pockets in the bronchial tube become dry and congested, and you have a shortness of breath. Particularly this type of respiratory problem we see is worse when you lie down. So this is so the person is able to breathe from the upper part of the lungs, but when they lie down, the congestion moves from the lower part of the lungs to the upper part of the lungs, and then they have more difficulty at night. But the main characteristic is it's non-productive. I mean, there's no phlegm, there's no mucus, there's no coming out, so it's not producing mucus. It's dry, wheezing type of breathing problem. So we can call it dry and cold type of respiratory problem, where the bronchi are restricted because of this dryness, which creates extra mucus and blockage and gives you shortness of breath. The other, and in Ayurveda we call this a Vata type. And then there's the Kapha type, where there's our productive type of respiratory problem, where you have mucus, phlegm, and congestion, and things like dairy, wheat, heavy foods, particularly like milk or yogurt at night, will make this condition worse. Early signs are just snoring, where there's blockage in the nasal passages, and you have to open your mouth, and this creates a snoring action. So if you even already have snoring at night, well, this is somewhat of a backup system of the respiratory system when the nasal passages are blocked. And of course, to stay alive and to receive your oxygen, or prana, we would say, then the mouth needs to open, and this can create snoring and dry mouth, and actually can exacerbate the problem, but it keeps you alive. So this is the second type, Kapha type, where there's congestion and mucus. The third type is more inflammatory, bronchitis with an inflammation where there's actually pain. This is where the bronchi become inflamed, and there's often soreness in the throat, pain, chronic coughing, chronic sneezing, and it can be either with dry and painful, or which is most common, or it can be with congestion and productive and painful, which is less common, because the mucus is what's protecting the bronchi and from this type of inflammation. So when it becomes too dry, it can become exacerbated, and it can become inflamed, and then you have a bronchitis where there's inflammation in the bronchial tubes. So you really want to first classify yourself in one of those three categories: dry with shortness of breath, and not non-productive, like a wheezing, or mucus and congested, productive, or painful and inflamed. And like I said, you could have a combination. It could be dry and painful, those two categories. So this will make a big difference in the types of herbs that you want to use. So we really have to address the treatment for these three different types. I mean, we could give them different types of medical names, but for practical purposes, we can think of the dry cough, the productive cough, and inflamed, not cough, but respiratory system. And then there's with cough and without cough. So often with the pain and the inflammation, you get the cough. And so then you want to choose the herbs accordingly. So let's just step back and talk a little bit about the causes of these respiratory problems and respiratory allergies. And according to Ayurveda and naturopathic care, in my experience, these respiratory problems are coming from poor digestion. We often say now, we hear a lot about all of our problems are coming from the gut. Well, gut really doesn't mean anything. It's just the abdominal area. But in fact, we're talking about the stomach, not the whole abdominal area, but just the stomach under the left rib. So when the stomach has too much mucus, too much mucosa, and the acids, hydrochloric acids, peptic acids aren't able to get out, and there's a sense we could say weak digestion, low appetite, not eating until 2, 3 o'clock in the afternoon, or eating a lot of times when you're not hungry, or eating a lot of cold, heavy foods will create this type of weak and congested digestive system. And eating it late at night, particularly heavy foods like dairy and fruit, sweet things, milk, cold milk at night. You could always have warm. Goat's milk, for example, is warm, and cow's milk is cooling. So if you had goat's milk with spices and ginger and a little cardamom, for example, it may not create this type of congestion. But often we have cold milk, cold foods, yogurt at night, and one of the worst food combining combinations is yogurt and fruit, or dairy and fruit. This ferments, creates more mucus in the stomach lining, and this seeps into the respiratory system. And we know that just by proximity to the left lung, that the stomach is very close. So we know that if you put, say, eucalyptus oil on your chest, that you can exhale out the scent, or you put peppermint on your chest, you can taste it in your mouth instantly. So this shows the permeability of the tissue in our body, that this oil, peppermint oil, for example, can go right through our skin, right through our bones, right through our fat, right into our lungs, and we can taste it right out our mouth almost instantly. It doesn't take very long. So can you only imagine this yogurt and cheese and dairy and snacks and, and congestive type of stomach situation there, where you have a lot of this mucus, and this absorbs through the stomach lining into the lungs, and then it clogs up the alveoli, the little pockets into the bronchial tubes, and this is the cause of this type of breathing difficulty. Now, if you have this type of breathing difficulty for many, many years, particularly if you're in the dry category, then this pockets, these alveoli, kind of get this toxic. It's like toxic because it blocks them, these little pockets, and it becomes dry and hard, and then it becomes very difficult to clean out these alveoli. So this is what these herbs are doing. They have a job. They're cleaning out the bronchial passages and tubes, and cleaning out these little pockets, these alveoli, and cleaning them out. And so you could think of it as a type of a lung detoxification. So we're going to talk about herbs that can help in these three conditions. I'll give you a remedy for the congestive cough, where you have mucus and phlegm. That's, you get honey, and like a teaspoon of honey, and then you put like 1/8 teaspoon of very finely ground black pepper with it, and you can mix it up in a little bowl. So it's like honey with black pepper, and you take this a few times a day. And if you took a 1/2 teaspoon or 1/4 teaspoon of black pepper straight, your eyes would just start watering and your nose would run. But when you put the honey with it, you can take larger amounts, but it still has the same action, this black pepper, of clearing and opening and dilating and that's exactly what we want. So this is a very nice treatment. But if you had pain and inflammation in the bronchi or bronchitis, then you wouldn't want to do that, because that black pepper could make it worse. So if you have this dry and raspy type of breathing problem, then you want to use more soothing herbs, demulcents and muciloids that are soothing, like a comfrey root. And one of the best, though, would be even just licorice. Just licorice root right there. Chopped up licorice. This is very soothing. By itself, probably isn't going to cure your respiratory problem, but it's helpful. Licorice, fennel, these are very soothing, very comforting. So just a tea of licorice, fennel tea would be very soothing for the respiratory system. We'll talk about another herb, and particularly for that dry type. If there's inflammation, then, it's probably just not inflammation in the respiratory. There's probably inflammation in other parts of the body. So you want to address this systemic inflammation in the body. And this would mean avoiding certain inflammatory foods like tomatoes, eggplant, sugar, chocolate. These are all inflammatory and can increase inflammation. And of course, if there's a history of smoking, then we can know that the villi and the lungs have been damaged, and this can create this type of dry and difficult breathing situation. So I want to talk about a few herbs, and we'll talk about how they address. First, we're going to talk about El Champagne. Anybody heard of El Champagne? Text me back if you had. El Champagne is used in a Chinese and in Western medicines. It's expectorant, an antispasmodic, analgesic, pain relieving, mild diuretic, carminative, rejuvenative, and it's used for colds, cough, asthma, cardiac asthma, and also muscle pain and fever. But its the primary use is in breaking up congestion, breaking up mucosa. And El Champagne is the key ingredient in my lung tea here. And lung tea, basically, you can think of it as a lung detox tea. Now, this would not be suitable for somebody with this type of hot or painful burning in the throat that was inflammatory. This is the best for somebody with mucus and congestion, that type, which I talked about earlier. And the first ingredient in there is El Champagne. And like I said, this is used both in Eastern and Western medicine and is very effective. And the next one I want to talk about is coltsfoot. Coltsfoot is really good for coughs. And if you see coltsfoot, it's kind of a little fuzzy and soft, and it's a little furry kind of herb. And it's the second ingredient in there after El Champagne. And then to make it a little more smoother and helpful for this dry type of cough, I've got camphor, marshmallow root, or slippery elm, and then mullein. We're going to talk about mullein, and ginger, and black pepper. So that's the expectorants. Now, coltsfoot is an expectorant, antispasmodic, demulcent, and diuretic, traditionally used for coughs, whooping cough, sore throat, low lung energy, sinus infections, and mostly I use it for coughing. So if you just have chronic coughing, you could just drink a coltsfoot. There it is, coltsfoot, all by itself, and that will help with chronic coughing, and it can help with mild forms of bronchitis, particularly if you mix it with some licorice. That will smooth it out. And then El Champagne is better for the congestion and the mucus. So if there was a lot of congestion and mucus, I'd put a lot of El Champagne. And if there was no coughing, I would put only a little coltsfoot. If there was a lot of coughing, I'd put a lot more coltsfoot. If there was dryness, I'd put more licorice, more fennel, more comfrey root. Another good herb that we want to talk about is a mullein. Mullein, again, similar to coltsfoot, fuzzy and expectorant, decongestant, bronchial dilator, opening up the bronchial packs, and very good for both the bronchitis, the inflammation, and the dry cough, not so much for the congested cough. So, and then another herb we want to talk about, which really should only be taken externally, not so much internally, is eucalyptus oil. Eucalyptus oil is, again, not good for the burning and the heat, but it's very effective for the congestion. And it can be good for the productive cough. And we can put it in a humidifier like this. It's a humidifier. It's got the little pocket right here to put the oil. So you put this in a room, even for a child that's having breathing problems. Put a little teaspoon of eucalyptus oil right in there. Let that run. And this is hot humidifier. And this will put it in a room with a closed door. And this will clear up the breathing. Even for a child having breathing problems, it's very, very effective. Particularly if there's snot and congestion. And you can have this run in the room all night, and the breathing will be so good that you may think in the morning that the whole problem is gone. And then when the person comes out and the cold air hits them, then of course the condition comes back again. Now, of course, when you're talking allergies, there's an immune reaction as well. So it could be related to the immune system is ineffective and overreacting. Sometimes people are taking too much stimulants, too much things that stimulate the immune system. Many shiitake mushrooms, reishi mushrooms are great immune stimulators, can overstimulate the immune system. And of course, there's many causes for allergies, and this becomes quite complex on allergies. But the first thing, even if you have an allergy, you want to clean out the respiratory system and do this, what I said, like a lung detox. And I showed you that formula right there. In Ayurveda, there's other herbs. Tulsi, Tulsi tea is very good and very helpful for both congestive and non-congestive, or productive and non-productive. And then there's Ayurvedic formulas too that are very effective. I have one. This one is called Respiratory Tonic Productive, and this is for congestive, mucus, snoring, productive cough, colds, and asthma, and it even helps with the cough related to flu. And this is spicy, hot, and it's got a Ayurvedic formula called Talasadi formula. It's already many herbs, plus Tulsi, which I just mentioned, and then an herb called Vasaka. Vasaka is a dilator, and this dilates the bronchioles and opens them up, just like the inhalers do, Vasaka. So instead of using inhaler, we put in a lot of Vasaka into it, and this opens up the bronchial tubes and allows it to breathe. If there's an allergy, then we have an herb called Shalish, and Shalish is like an antihistamine to help the immune system not react too much. So if there was an allergy aspect to this condition, then Shalish can be added to any of these formulas. And we're talking Indian herbs. And we'll see these Indian herbs are taken in powders, and you just mix them with a warm water. And this one is respiratory tonic, but non-productive. And it's for more of a dry, difficulty and painful breathing, dry cough, asthma, bronchitis. And it's based on this very famous Ayurvedic formula called Stipulati Churna, or Stipulati formula. And again, it's got Tulsi, which is used in Ayurveda for all respiratory conditions and even the common cough and cold. And then licorice and fennel, which makes it smooth for the respiratory tract. And then Vasaka again, the dilator. So really the trick is getting the right herbs for the right condition and being able to diagnose the condition, whether it's which type of allergy, whether it's an allergy reaction, whether it's congestion in the bronchi, or it's somewhat toxins built up. So recently there was a fire up here in Ojai, and a lot of people had respiratory problems. And that was because of the amount of heavy toxins that resulted from the fire, and where the air became very poor. And so many people came to me with respiratory problems. And then I gave them this tea because it was like a lung detox tea. And most people said one bag of tea was sufficient and their breathing condition improved. But can you imagine if you live next to a highway or you live somewhere where there was a lot of toxins and pollution in the air, and you breathe these in for years? So this would create this toxic buildup inside of these little alveoli, these little pockets inside of the very end of the bronchial tubes. And this builds up over time, creates a type of irritation, which creates inflammation and can create an immune response too, because whenever there's anything toxic in the body responds to it with its antibodies, and there's an immune response. So these toxins that people got from the fire, or living next to a chemical plant, or living next to a highway for years and years, get lodged inside of the respiratory system, particularly these alveoli, these little pockets. And this herb is cleaning it out, flushing out these toxins, getting them out of the system. So those are the main herbs, but there's also other ways you can administer these. You can put them on your chest. You could get in a carrier oil like olive oil or sesame oil. Don't use coconut oil because that's too cooling. Get sesame oil and put a little eucalyptus oil in it, just a few drops, and rub this on the chest like a chest rub. There's many products available with menthol and eucalyptus oil, and this will penetrate right through the tissue, right into the lungs, and break it up and help to improve breathing. Now in Ayurveda, there's a very common treatment which helps with all these respiratory conditions, particularly if it's not being successfully treated with just the herbs. If the herbs are not able to detoxify and cleanse it out, particularly if the person's had the respiratory problem for 20 years and has been on inhalers, because a lot of these inhalers are very dry, and even though they dilate, they dry out, and they actually keep this toxins in the alveoli and dry it out, and it's very hard to get it out, even with the herbs. So then what we do is we put this oil on the chest, with a little eucalyptus oil or a little mustard oil in it, and then put a heating pad over it, and do this every day for 5 or 6, 7 days to loosen up and you kind of liquefy these toxins in the body. And that can help. And then you can go back to taking the expectorants and the decongestant herbs that I just spoke about. You just have to get the right formula for the individual. And this can be very helpful, this warm oil first to break it up. Another very common treatment in Ayurveda is, they call it vamana, or controlled vomiting, eminence. And this is where you would drink like 30 ounces of licorice tea. See, the licorice is soothing and liquefies and gets in the stomach and liquefies the mucosa. And this is to clean this mucus and congestion out of the stomach, because that's the cause. And so you drink 32 ounces, or until you're just full. You can't drink anymore. Anywhere from 16 to 32 ounces of licorice tea. And then when you almost feel like you want to throw up, you can get a little warm cup of salt water, like 1 cup with a whole teaspoon of salt, warm salt, and sip that until you feel like throwing up. And then you bend over a bucket, put your finger in the back of your mouth if necessary, and then you vomit up this water, this licorice tea, and this will clear out the whole stomach lining and get rid of all the mucus. Now, of course, those are two separate treatments there. One, the controlled vomiting, and two, the hot oil pack. So, these are additional treatments that could be used if just the herbal treatment is not effective. The real quick trick is, of course, diagnosing and determining which of the conditions you have, and then which herbs and which treatments would be most effective. And that really has to be done on an individual basis. But some things like just having L-champagne for congestion, or colt's foot for cough, would be fine. May not solve your problem, though, long term. Another one, which I don't have here, is lobelia. Lobelia is used for smoking problems, to help people to get off of smoking. and smokers cough, and we actually use it to help people get off of smoking by mixing it with tobacco, and then they smoke it together and slowly reduce down the amount of tobacco and just use the lobelia. But lobelia is known also for helping for coughs and the respiratory problems. So it's good just to understand these herbs, individually first, so then you can make a formula that's suitable for you. Okay, so that pretty much covers this subject, and I hope that you get your humidifier, you get some eucalyptus oil, and you can always find there's many lung formulas out there, and you can find a lung formula and try it. But if you're serious, if your condition is more serious and it's not resolving on its own, then you want to meet a professional who can formulate the herbs for you and maybe help you find the right treatment that works for you. So I'll end the webinar now, and then for those of you who are logged in, you can text me, and I'll stay here for you and answer your questions. So I want to thank you very much, and I hope this helped you to improve your breathing and your respiratory system. And remember, just snoring, having difficulty breathing, shortness of breath, these are all early signs of respiratory problems. So try to address these in the early stages and not let it become too serious or chronic. It's very easy to treat in the early stage and very difficult to treat after 20 years of the similar problem. Okay. Thank you very much.